Hi, I'm Dr. Mike, and you're about to see some graphic surgical video. We have some patients that actually want to see what a surgery is like before they go through it. So if that is something you'd like to see, then continue watching. If you would not like to see a surgical procedure, then I would recommend to not watch this. Okay, so this is Helen's day of surgery. So now she's getting her IV anesthetic by one of our CRNAs, Dan. Fantastic CRNA, and she's asleep at this point. We're giving her what's called local anesthetic. And now we're putting in the markers for her. These are little breadcrumbs. She's all numbed up right now, and we're just putting in these markers so that we can then scan with one of our digital scanners. So we do everything digital. We're picking up where her teeth are. We're going to mesh that with where I've designed her new teeth to be. And now we're putting in more local anesthetic because I want her super duper numb. Even though she's asleep with an IV, I still use lots of local anesthetic. Now we're taking out the teeth. I joke with patients that this part only takes about 5 minutes to take out the teeth, and her case is just like that. We sped it up a little bit here, but all the teeth are out. The next step we're going to do here is going to be the flap. So we're doing one incision here so that we can actually visualize the bone and visualize where the implants are going to go in the bone. So we make one incision. Again, she's totally numb here, not feeling anything, so I'm kind of pulling away the tissue here a little bit just so that we can visually see the bone. We do it on the inside and the outside. It doesn't take very long. And then the next part coming up, we call this bone reduction or an alveolectomy, or kind of leveling the bone, because when the teeth are out, it's the bone's all kind of wavy, and we want it all nice and flat like a level dance floor. There we just drilled one of the holes for the implants, and now that's an actual implant that I'm screwing in. And it's a titanium implant. We're screwing it in by hand, getting the torque, getting the angle, getting exactly where we want it. You can see 3 of the implants. You can't see, she actually has 6 of them in there. But now we're putting on little gold things. We call these MUAs, or multi-unit abutments. And then those little things on top, we call them dominoes. We're putting those on. And all this is to coordinate where the implants actually are. And we're doing a micro mapper, which is photogrammetry. We took a digital scan and we put all that together, and now we have her teeth that we've 3D printed in office, and we painted them. And now we're actually screwing those teeth on, and all this is something we've designed beforehand, and we're tightening all those down. And that's it. Her surgery's done. Everything went fantastic for her. Probably her upper arch took us maybe about an hour and a half to do. So stay tuned to see the final.